So an AMH of 0.17 is definitely a low AMH determination. It's telling us that there is a low ovarian reserve. Even if this AMH it's in nanograms or in picomole, it's a low AMH. If this is in picomole, it's even a very low AMH. So what this is meaning is that when we perform ovarian stimulation, we are going to collect very few eggs, probably in the range of between 1 and 3x maximum. If this is picomole, even less than that. So at 41, we have the additional problem of age. And what happens with age is that the probability of each egg to become a viable embryo, it becomes lower. So at 41, we're going to need an average of 10 mature eggs to have one viable embryo. And when I mean one viable embryo, I mean a blastocyst of good quality, an embryo that has developed properly to the blastocyst stage. And once we are analyzing them from the chromosomical point of view, this embryo is completely normal. It's what we call an euploid embryo. So if we keep in mind that at 41, we're going to need an average of 10 mature eggs to have one normal embryo, and with an AMH of 0.17, maybe we're collecting 2 eggs, that means that the probability at the end of the day of having one normal embryo is going to be very low. So most patients in this situation will end up without not having even an embryo transfer because they are unable to produce a viable embryo. Having said that, it is true that if that happens and we end up with one good embryo, one normal embryo, the chance of pregnancy will be good, because if the embryo is of good quality, is chromosomically normal, and from the uterine side, there are no issues and everything is fine, then the probability of that embryo to implant is going to be good. It's going to be probably above 50%. So that would not be the problem. The problem would be really to get that, to have that embryo. And at that age and with such a low ovarian reserve, that's a very low probability to happen.